Hi, I hope you're having a great day. Well, before the weekend starts, I want to talk about 5 medical parameters that you can do whenever you do your tests. Now, a lot of these tests are not usually prescribed in normal cases, and there's a reason why I'm asking people to give importance to these metrics, especially if you're getting a blood test done. Because you see, when you focus on treatment, you're only looking for symptoms, because only when you can label a condition or label a disease is the time that you can prescribe a medication. That's treatment. It's great for the symptom. But when you're looking at healing, or when you're looking at making sure that the problem that you have doesn't come back over and over again, then you start looking for root causes. You try to look at not just why you have cholesterol, what your cholesterol levels are. You try to find out, why is my body producing more cholesterol? Why do I have diabetes? Why aren't my sugar levels functioning the right way? You try to get to the root cause of the problem. So reports, medical parameters are great. They're part of a diagnostic tool. It doesn't mean it's conclusive. So it doesn't mean that any of the levels that we talk about today means that if your levels are out of range, it has a specific problem. You see, when you're looking in the human body, which is complex, brilliant, and intelligent, every cell, every tissue, every organ of the human body is connected with one another. So when you look at one parameter, it can give you clues as to what else is happening in the human body. And we need those clues when we're trying to address the root cause of a problem and get to that root cause and try to heal and not just treat. The first one is ESR. ESR is extremely important for you. This is the erythrocyte sedimentation rate. This gives you clues as to the inflammation in the human body. Like I constantly say, it's about chronic inflammation in the human body. Chronic inflammation creates problems ranging from infections that can go undetected, to tumors, to cancer, to autoimmune disorders like lupus, arthritis, rheumatoid arthritis, vitiligo, psoriasis, eczema. It's inflammation at the end of the day. And this test can give you a clue. Like I said, it's not diagnostic. This doesn't mean it's non-specific. What I mean is it can give you a clue. Sometimes what can cause ESR is something as simple as an infection in the body, and as the infection goes out, your ESR comes down. It's as simple as that. Sometimes it can be more complex. It could be tuberculosis. It could be any of these things. So it needs to be investigated further. When you investigate, it doesn't only mean that you do test after test, but you start introspecting and asking yourself the right questions about your lifestyle and what could have created that inflammation, so then you don't just get to treat it, but you get to heal it at the same time. So we look at ESR. You have joint pains, you have spine pains, you have knee pains, all of these issues. Look at your ESR. It is a biomarker for inflammation in the human body. When there is chronic inflammation, there is pain. Now, there are not too many medications that can treat inflammation, which is why it's probably not looked at most of the times, because you can't just go out and buy drugs that may just take care of your inflammation, besides NSAIDs, which are basically anti-inflammatory steroids, which only suppress the symptom, and it may be required if you need it. But the whole point is, most inflammation can be controlled with lifestyle changes. We're going to talk about that a little later. Then you have CRP, which is C-reactive protein, an extremely, extremely important test. Now, it doesn't mean if your CRP is high that you have cancer, that you have diabetes, that you have a heart problem. But again, these are biomarkers talking about chronic inflammation in your body. It could be ranging from tumors to cancer to possible cardiac arrests and inflammation in your arteries. Remember, we talk about cholesterol. Cholesterol keeps getting the bad rap, but it's not really just about cholesterol. It's about inflammation. Inflammation causes strokes. Inflammation causes cardiac arrests and heart attacks as well. But we don't look into this. We just look at cholesterol levels and we ignore something that poor lifestyle causes, which is called chronic inflammation, which has its connection to almost every single disease. So we look at CRP. You have normal CRP. This is a protein molecule. It's produced by the liver in response to chronic inflammation in the human body. Now, for example, you get hurt today. Your body produces inflammation, your CRP goes up. You go through a surgery, your CRP levels are going to be extremely high because you've cut open the body, and that's the inflammatory response. That's not a bad thing. Your CRP will come down, your inflammation will come down as you heal. But if it stays chronic, that's the time you got to start looking what's happening in your body. So it gives you clues, and like a detective, we got to collect these clues and see what it's all adding up to. We just don't keep popping pills to mask the symptom, to suppress the symptom and push it back down into the body. So the moment the body throws up a symptom, I always say a symptom is your body doing the right thing at the right time for you. It is telling you that something's wrong, and we just don't go and cover it with a band-aid. We just don't go and suppress it with heavy chemicals. We do if we want to contain something, but we also got to get to the root cause of why is my body giving me this symptom? Why am I getting constant migraines? Why am I getting constant headaches? Why am I bloating constantly? Yep, there's a pill that can give you immediate relief, but you're masking the root cause. Your cause of your migraine could be chronic constipation. You don't take care of your chronic constipation, you're going to have a hormonal imbalance, you're going to have acidity, you're going to have bloating, you're going to have gut issues. You have gut issues, you have immune problems, you're susceptible to anything happening in your body. So we want to try to get to the root cause, and CRP is a fantastic marker to tell you exactly what is happening in your body when it comes to inflammation. Like I said, it is non-diagnostic. It doesn't mean that you have high CRP and you think you have cancer. You got to further investigate it, put everything together and figure out what's happening in your body. So sometimes you have high ESR and you have a high CRP. There's inflammation, possibly with infection, because the human body, the immune system, handles infection by creating inflammation in the body. So you see, it always doesn't have to be a serious thing. It could just be your body doing the right thing at the right time, but you got to keep a tab on it. Because if it's chronic inflammation, that's going to be a problem if you don't address it at some point. The fourth test is my favorite. It is TPO, which is basically your thyroid peroxidase. This is an antibody test which people should do if they think they have autoimmune. It is such an important test today. I can't tell you, there are thousands of people out there right now who think they have a thyroid problem, and they possibly do because their TSH and their T3 and their T4 is high. And so they're given a thyroid medication thinking they have a thyroid problem. But in most cases, it could be Hashimoto's. It could be an autoimmune thyroid problem where your treatment can be completely different. It involves healing your gut. It involves understanding why your immune system is an autoimmune attacking your thyroid gland. By doing this simple test, which is a TPO test, it measures the amount of antibodies which are in your blood. They shouldn't be in your blood, but somehow because you have a leaky gut or you have poor gut health, these antibodies which are supposed to exit your body enter your blood. They're not supposed to be in your blood, so your immune system starts attacking them. A lot of these antibodies operate in something called molecular mimicry, which means they mimic certain molecules like your skin, your thyroid gland, your joints. So your immune system starts attacking you. So if this molecular mimicry is for your joints, your immune system starts attacking your joints and you have arthritis, you have knee pains, you have all of the joint pains, and no amount of painkillers will solve your problem. Yep, it'll help you get relief, but the root cause of the problem is something different. If these molecules mimic your thyroid gland, your immune system starts attacking your thyroid gland. You have Hashimoto's, you have a condition of autoimmune thyroid. If it mimics your skin, you have psoriasis, you have eczema, where your immune system is attacking your skin. No amount of creams and lotions and all of these things is going to help your problem. It may help you symptomatically, but it's not going to help you at a root cause level. So doing a TPO test or a TG test, which is a thyroid globulin, will give you a clue as to what's happening when it comes to inflammation and autoimmune disorders in the human body. Sometimes people don't show, their reports don't show that they have a thyroid problem. But if their TG and their TPO is on the higher side, it shows that you possibly can have a thyroid problem in the future. So you see, it can be very preventative in nature where you start doing the right things to heal your gut lining, and you can stop the process of your immune system attacking your body in most cases. And then we have my two favorite, which is B12 and D3. Such important levels in the human body. It has every connection with Alzheimer's, dementia, Parkinson's, inflammation in the brain, inflammation in your neurological system. You see, B12 has several functions. If we have a deficiency today, we won't feel it. Maybe fatigue, tiredness, and we think we're tired and fatigued because we've not slept at night, or we eat more calories, or we eat more sugar to feel better, or we take more stimulants like tea and coffee. Sometimes all it could be is a deficiency in B12 and D3, which explains your chronic fatigue, besides certain lifestyle changes which you need to introspect and look into it. So if you have low B12 today and it's cumulatively building up over the years, you have poor neurological health, and that has every connection with Alzheimer's, dementia, and all of these things. And as you can see, the world is getting better at telling us, hey, you have a problem, you have a disease, you have a condition, but we're not getting better at solutions of why is it happening in the first place? What can we do to prevent the onset of Alzheimer's? What can we do to prevent the onset of dementia and Parkinson's? But apparently there's no research about it. But we got to use common sense and logic and see that even one deficiency in the human body can lead to these things over and over the years. It's a simple example of alcohol. Today, you're young, you can drink as much of alcohol as you have, and you say, oh, my body's strong, I can take it. Yes, your body can take it, but degeneration in your liver and your brain cells is a slow process. It happens over the years. So the years of over drinking and binge drinking will finally add up and produce a problem much, much later, not right now. The body has a set point that I always keep talking about. It's extremely resilient. It will not show you symptoms right now. But over the years, the cumulative add up and build up of all of this will create a problem at some point, which is why I say, don't stop drinking. Drink in moderation. Don't stop eating. Eat your favorite foods, but don't overeat. Don't undereat. Don't overexercise. Don't underexercise. Don't oversleep. Don't undersleep. Don't overthink, and don't underthink. It all comes down to balance in the human body. So it is ESR, it is CRP, it's TPO and TG, it's your D3, and it's your B12 levels. This is over and above your common CBC, your liver function test, your kidney function test, your lipid profile. These are great benchmarks to assess what may be happening in your body. Okay, it doesn't mean that if you have high CRP today, you Google and you see every connection with cancer. Don't Google. It's not going to help you. Like I said, it gives you clues as to what could be happening in your body. I could simply bang my elbow on this table really hard right now. There would be inflammation produced as a normal defense mechanism. My CRP might go up. Does this mean I have a problem? No, I don't have a problem. I'm aware I banged my elbow really hard on the table. So let's quickly go over exactly what inflammation is. Now picture this very carefully. So I take a pin and I poke it into your finger, okay? So I've damaged some cells. Now any cells in the human body get damaged either with viruses, bacteria, toxins, some traumatic event, it's a wound, it's a cut. What's going to happen? These damaged cells release certain chemicals. Examples of one of these chemicals is histamine. These chemicals stimulate the immune system to start rushing white blood cells, also known as phagocytes, to the injured area. So these phagocytes or white blood cells come towards the injured area to protect you, to engulf the bacteria, the virus, any germs, any pathogens. Natural defense mechanism for human body. Also what happens is these chemicals causes a break in your blood vessels to move fluid into your tissues so that there's a swelling. That puffiness, that redness and a swelling is the simple brilliance of the human body to produce inflammation, to separate the injured area from the healthy body tissues. So it produces like a kind of an umbrella effect, which is nothing but a swelling. Now, all of this is the natural defense mechanism of the body. It is required. So now some pus may form, which is nothing but a collection of the dead white blood cells, the dead bacteria, the dead viruses, or whatever it is. That is septic, the pus forms, it moves away, and you heal. That's acute inflammation. It is required for us, for our defense and for our survival and for our protection. The problem is when the inflammation is chronic, when the body produces inflammation but doesn't switch it off. The inflammation stays constant in the body because of fluctuations in our hormones, toxicity in the human body, new antibodies being produced. So your immune system is always flared up and attacking and attacking and attacking, and it stays into autoimmune response, which means you have chronic inflammation. And that chronic inflammation affects the behavior of cells. It changes the DNA of cells. And that's when you have rogue cells that start misbehaving, multiplying, dividing abnormally and out of control. So that's the difference between acute inflammation and chronic inflammation. And these are some of the tests that can give you a clue as to what is happening in your body. Have a great weekend, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.